Hello, everyone. With uncertainty during COVID era, most of us are probably having issues with our sleep. Well, Dr. Nishi Bhopal, MD, who's board certified in psychiatry, sleep medicine, and integrative holistic medicine, is going to educate us about the importance of good sleep and what all of us can do. I am Amita from Nourish Talk, a global platform for natural, holistic, and integrative therapies. I'd like to introduce all of you to Dr. Nishi Bhopal, a triple board certified MD with advanced training in integrative psychiatry and sleep medicine. Dr. Nishi is joining us live from San Francisco. Welcome, Dr. Nishi.
Thank you, Amita, and hello, everybody. Thank you for inviting me to speak today. So in today's talk, we'll be exploring one of the foundations of health, which is restorative sleep. So as Amita said, we're in the middle of a global pandemic, and it's been a very challenging time for many of us. And the stress of the pandemic is contributing to a myriad of issues, including issues with sleep. And this is for a variety of reasons. So today, we're going to look at the consequences of insomnia and poor sleep quality. And then we'll look at some holistic approaches to improving sleep quality without medications. So we'll look at some approaches from Ayurveda, Cbti, which is cognitive behavioral therapy for insomnia, and some general principles from integrative medicine. Next slide. So first of all, we'll just take a quick look at insomnia and how to understand the sort of what it is. So it can be categorized into two main types. So there's acute insomnia and chronic insomnia. So acute insomnia is usually caused by a specific source of stress. So it could be something that's happening like a global pandemic or some other external stressor. Usually it only lasts for a few days or up to a few weeks, and then typically resolves once the stressor has moved on. Chronic insomnia is more longer lasting. So this is defined as difficulty falling asleep or staying asleep for at least 3 nights a week, and it goes on for more than 3 months. Next slide. So I'm presenting this from the USA. I know we have an audience that's international from other countries, but most of my data is going to be centered on the US since that's where I am. So we'll see here the prevalence of insomnia. So about 25% or 1 in 4 Americans experience acute insomnia every year, and about 1 in 10, so 10% of Americans experience chronic insomnia. So that's quite a large number. Worldwide, we don't have great estimates on what the worldwide prevalence of insomnia is, but studies show that it's somewhere between 10 to 40%. So again, still quite a large number. It may be even as high as 60%. And we know that sleep issues and insomnia are most common in older adults, females, and then people who have other underlying medical and mental health conditions. Next slide. So struggling with sleep is associated with psychological distress. And it's not just at the time of sleep onset. So we often think of sleep issues and insomnia as being a nighttime condition, but it's actually something that affects us throughout the entire day. So it affects us at night, during the daytime, during our waking hours. And this struggle to try to sleep actually perpetuates the cycle of insomnia. So we can see that here, this vicious cycle of insomnia. So that vicious cycle and that struggle then actually reinforces the sleep disorder, the sleep issues. So it becomes a self-fulfilling prophecy or self-perpetuating cycle. So we can see here in the example, some of the thoughts are unhelpful thinking. So some of the thoughts are, if I don't sleep now, I'll feel awful tomorrow. So you start having this thought, and then you start feeling anxious about it. And that makes you feel more awake and more alert. And then you start feeling frustrated, you start feeling anxious, you may feel angry, or a variety of emotions that then put you in a hyper aroused state. So that kind of revs up your nervous system. And then you might start watching the clock, or you start tossing and turning, and then your body's awake and you start having more negative thoughts about it. And then you see how it feeds into that cycle. So what we're going to look at today is ways that we can break this cycle. Next slide. Okay. So these are some of the health issues associated with poor sleep. So most of us know that when we don't sleep well, we don't feel well, and it affects so many different systems in the body. So you can see here, this is just a small list of the things that can happen when we don't sleep well. So we can feel fatigued, tired. It can cause issues with weight, sometimes weight gain or even weight loss. It can cause a dysregulated metabolism and hormone issues, obesity, high blood pressure, mood issues like depression and anxiety, chronic headaches and pain. It can cause physical deconditioning, sexual dysfunction, so many things. So this is just a small sample of what can happen. So why do we want to take an integrative approach? Why not just take a pill? You know, sometimes you can just pop a pill and sleep well, but why don't we want to do that? So sleeping pills have a number of risks. They are widely prescribed, but there are long-term risks with taking sleeping pills and sleep aids. Some of these are actually the very issues that we're trying to solve. So sometimes taking sleeping pills long-term can cause rebound insomnia. So you can become dependent on the sleeping pill, and then you can't sleep without it, and then you have more insomnia. So it's actually causing the very issue you're trying to treat. There are studies showing that it can cause memory and concentration issues. So we see here that people who take sleeping pills long-term have a 5 times higher risk of memory and concentration problems, a 4 times higher risk of daytime fatigue, twice as high of a risk of falls and fractures. And this is especially dangerous in older populations who are at risk of fractures of the hip and wrist, and then twice as high of a risk of having a motor vehicle accident while driving.
But in the US, the use of sleeping pills is quite high, right? If I don't know the data, but I mean, just
Yes.
prescription drugs, right, for sleeping is quite high.
Very high. It's very high, and I can find the statistic. I have that somewhere about the percentage of the use, and it's a big business too. It's like a billions of dollar business in the U.S. And the thing is that sleeping pills and sleep aids are not bad necessarily.
Yeah,
it's how we use them, right? So they're a tool that we can have in the toolbox, but we have to use them appropriately. So it's not that you should never take a sleeping pill. So if you have acute insomnia that's related to some kind of stressor, so for example, you lose your job or you're going through a divorce or something like that, sometimes short-term use of a sleeping pill can kind of help you get back on track with your sleep cycle. So I recommend always using the lowest dose possible for the shortest period of time. Generally, no more than 2 weeks is recommended for a sleeping pill. So those issues that we just went over, those are with long-term use of sleeping pills. So if we're taking them for months or years.
Sure.
So how do we treat insomnia without sleeping pills? So what's the approach? So the first thing you want to do is identify what the root cause is. Because unless you know what's causing the sleep issue or causing the insomnia, you can't effectively treat it. So that's the first step. And so we'll go into that in more detail in more detail on the next slide. But the first thing is to identify the root cause. Then you can start to implement various therapies. And so we'll look at Cbti, cognitive behavioral therapy for insomnia. We'll look at some approaches from Ayurveda, and then we'll look at some supplements as well. So root cause. So I like using this Ayurvedic framework because it's really comprehensive. Ayurveda has a very sophisticated understanding of sleep and the importance of sleep and the circadian rhythm, the body clock, and the understanding of the body clock and circadian physiology is very aligned with the modern Western understanding of the circadian system. So, and this is from 5,000 years ago. So it's quite interesting to see how things are lining up with modern science. So Ayurveda divides the root causes of insomnia into 4 primary categories. So we have food, environment, emotional causes, and medical causes. So the first one, food. So you know that if you go to bed hungry, you might wake up later. You might not sleep as well. You might wake up in the middle of the night feeling like you want to eat something. So excessive hunger can sometimes be a simple thing that causes sleep issues. So that can be a simple fix. Foods that cause too much pitta, so too much fire, acid reflux, can contribute to insomnia or sleep issues, or foods that are too drying, that are exacerbating vata. So you want to be thinking not only about how much food you're eating, but the types of food that you're eating and the timing of the food. So that's one simple thing to assess. The next thing is the environment. So making sure that your room is dark. So excessive exposure to light can contribute to sleep issues and can cause disruptions in the body clock. Excessive noise, ambient noise, can be disruptive. Extreme temperatures, we're kind of going through a little bit of a heat wave now in the Bay Area, and so a lot of people are complaining about the disruption of sleep because of the heat. So temperature, so controlling the temperature of your bedroom can sometimes help. And then poor sleep hygiene, so poor sleep practices around sleep. The environmental one is really interesting. I had a patient who had not been sleeping well for years, over a decade. And so she came to me for help with sleep. And so we examined, so I always go through these root causes and ask step by step, you know, what's going on. And it turned out she was sleeping in she had a studio apartment and she was sleeping in her closet. So she had her bed in the closet where there's no ventilation, no windows, little tiny space, door shut, and she was sleeping in there and she couldn't breathe. So I said, of course you can't sleep, you can't breathe, you don't have good ventilation, you don't have good airflow and circulation. So we actually had her move the bed out of the closet. She had a little studio apartment, so she moved it to the window, put up a nice room divider, created a separate space. And literally overnight, her sleep improved. And that was it. That was all that needed to happen after years of trying sleep aids and all these other things. So
no problem with the food or anything else, emotional issues, just the environment.
Plus the environment. It's incredible, right? So simple things can make a huge difference. Other simple things with the environment can be the types of sheets that you use. So I always recommend using 100% cotton sheets because they're more breathable. So a lot of us get hot when we sleep, and you know, like I was just saying, temperature has an effect on sleep quality. So simply changing your sheets from synthetic fiber to natural fiber like cotton can have a huge impact as well. The next category is emotional. So if we're stressed out or if we're struggling with anxiety, if there's depression, or other, you know, emotional issues going on, of course, that can contribute to sleep problems. We're learning that the relationship is bidirectional. So what that means is that we know that anxiety and depression can contribute to sleep problems, but we're also seeing how sleep problems in themselves can then cause anxiety. So it feeds into that loop that I had mentioned earlier. It goes both ways. So it's really important to not only focus on treating the sleep, but if there's anxiety and depression, we want to address that piece as well. So we need to look at the whole picture. And then the last category is medical. So looking at medical issues that can exacerbate sleep problems. So these can include neurological disorders, chronic pain, endocrine disorders. So that would be like a thyroid condition can affect sleep. Sleep apnea is a big one that I always try to rule out with my patients. So sleep apnea is when people don't breathe properly during their sleep. And sometimes simply treating that is enough to kind of you know, get to the root cause and restore their natural sleep patterns. RLS and PLMD, that's Restless Leg Syndrome and periodic limb movement disorder. So these are movement disorders that can happen during sleep, and sometimes people complain of their legs feel restless at night, or they just can't get comfortable, or they feel like they have to get up and walk around or move around, or they kick a lot in sleep. And sometimes that can be related to low iron levels or things like that. So that is something that can be assessed for medically. And then we have specific sleep disorders themselves, like narcolepsy and circadian rhythm disorders, so body clock issues. So, so that's kind of like the medical issues in a nutshell. Okay, so Cbti. So Cbti is cognitive behavioral therapy for insomnia. There's several components to it, which you can see listed here. So psychoeducation is an important component. So that is simply just kind of educating the person about sleep, the mechanics of it, the science of it, how it works, understanding the physiology of it. So that's really the first step. Then there's sleep hygiene, which I think most people have heard about. Stimulus control. Oh, the formatting's a little bit off. So stimulus control is the next one. So that is really controlling how much time you're spending in bed. Because if you're spending too much time in bed, tossing and turning, it feeds into that loop that we looked at before. So it actually creates more anxiety about sleep, which can then create more sleep issues. The next one down is relaxation training. Then the next one after that should be sleep restriction, and then relapse prevention. So we could do a whole series on CBTI itself, so I won't go into too much detail on this, but on the next, we'll look at a few simple principles from CBTIs just to get a taste of it. So before I talk about this, I'll just mention that CBTI I always like to emphasize this. Cbti is the best treatment that we have for insomnia. Once you've ruled out the underlying conditions, if you've treated those and you're still having insomnia, Cbti is the best treatment. And it's recommended by the American Academy of Sleep Medicine and the NIH consensus as a first-line treatment for insomnia. So the first thing you should do before you even do medication. And doesn't have side effects, and it's more durable and safe over time. Okay, so a few little simple things from Cbti that I'll just share. So one is to go to bed only when you're sleepy. So I hear a lot of people tell me that they go to bed at 10 o'clock because it's bedtime, but they're not sleepy yet. And then they're tossing and turning for an hour, and then it feeds into that whole insomnia cycle again. So what I would recommend is wait until you're sleepy to get into bed. So what that means is your eyes are heavy, maybe your head is starting to nod, your body feels heavy. That's when you want to go to bed. You don't want to go to bed when your mind is still awake and alert, because that's going to make it harder to fall asleep. If you fall asleep okay, but then you're waking up throughout the night, if it's more than 20 minutes and you're wide awake or you're tossing and turning and getting restless, you want to get out of your bed. So get out of your bed. You can go to the couch or go to a comfortable chair. Get out of the bed and go elsewhere, and you can lie down. You can read a book, or listen to a meditation or something like that. Keep the lights to a minimum. But the idea here is, again, if you're starting to get restless, we want to remove the association of anxiety from the bed. So you want to move out of the bed and go elsewhere, and then when you get sleepy again, you can go back to the bed. The next thing is to use your bedroom only for sleep and intimacy. And so this is a tough one because a lot of us are working from home, and a lot of us don't have space, so people are working in their bedrooms. So what I recommend is at least don't sit on the bed and work. Don't sit on the bed and work. Don't sit on the bed and study or read. At least keep the bed for sleep only, and create a little space. And if you don't have a lot of space, you can get a little fold-up table and a fold-up chair and work from there. But you want to be very vigilant about using the bed only for sleep and intimacy if you have sleep issues particularly. Then the third tip is to get up at the same time every day, no matter how much sleep you got. So even if you didn't have a great night's sleep, you still want to get up like clockwork at the same time every morning. And this helps to regulate your circadian rhythm and your body clock. Otherwise, if you're getting up, let's say, 7 a.m. one day, 9 a.m. another day, it creates a jet lag effect. So that's like a 2-hour time differential. So it's like you're traveling from San Francisco to Chicago, every other day or something like that. So you want to be really regimented about that body clock. And that's going to help improve your sleep quality over time. Next slide. Okay. So good sleep starts during the day. And I can't emphasize that enough, because if you're stressed out and running around and trying to get things done and you're frazzled all day, and then you expect to go to bed and fall asleep, that's just not going to happen. So you want to make sure you're setting yourself up for good sleep during the day. So the way that we do this, one is to reduce stress during the day. And so, one of the elements of reducing stress is managing the negative thoughts you're having about sleep. So if you notice you're having those thoughts like, oh my gosh, I'm not going to be able to sleep tonight, I'm going to be so tired, it's so frustrating, you want to really pay attention to those thoughts and start to address them. And this is where the Cbti principles can be really helpful, because those thoughts are not helping, right? So that's one aspect of it. The other is regulating your nervous system. So if you're in a state of high stress and hyperarousal, that's going to make it harder to sleep. So you want to think about whatever helps you reduce stress during the day. So it could be meditation, it could be yoga, it could be going for a walk, it could be doing some stretching, whatever works for you. You want to implement those practices on a daily basis. The second thing is exercise. So pretty self-explanatory. The formatting. So it should say exercise. And so you want to just make sure you're not exercising too close to bedtime. So you want to be getting your endorphins and adrenaline up right before you go to bed. But exercising at some point during the day is helpful. The regular schedule I just sort of talked about. So making sure your body is on a clock. And in Ayurveda, they emphasize this, right? And there's different times of the day that you should be doing different activities. So keeping a regular schedule is very important. And then controlling light exposure. So light exposure affects our sleep-wake cycle, and it also affects melatonin levels. So our brain produces melatonin at night when it's dark And then it stops producing melatonin during the day when it's light. So the light suppresses our natural melatonin production. So we want to leverage our light exposure during the day and during the night to promote a healthy body clock and healthy melatonin production. This can be challenging because, again, most of us are working from home and we're not outside. And so we're using artificial lights, especially in the evening. So on the next slide, we'll take a look at what we can do. So next slide. Okay. So during the day, what you want to do, again, waking up at the same time every day, when you wake up, you want to get a dose of bright light. So what that could look like is either opening up the curtains, and if you have a large window, you can simply do that. If it's, in the Bay Area, we get a lot of sort of gray, foggy days. So if it's sort of gray or overcast, you can turn the lights on in your bedroom. You could even consider getting a light box or a sunrise alarm, which is basically a device that gives off bright light. And a sunrise alarm is kind of like it's an alarm clock that looks kind of like a globe. And what you do is you set the time, and then at the time the alarm is set for, it starts to gradually get brighter. It's like having a sunrise in your bedroom. So you're simulating a sunrise. And this is really helpful in the winter when you're, if you have to get up at 6 a.m. or something and it's still dark out. Then during the day, you want to stay in bright light. So keep the lights on wherever you're working, go outside and get a dose of bright light. Now, let's see, the nighttime one, the formatting is a little off here. So
yeah, I don't know what happened here.
I'll just talk about a little bit some of the points that should be there. So we want to think about doing the opposite. So at night, you want to keep the lights dim after about 7 or 8 p.m. So think about sundown. You want to keep it dark in your house as well, because sometimes the tendency is when the sun goes down, people turn on all the lights in their home. And so that is going to prevent your body from producing melatonin, and it's not going to signal to your body that it's nighttime and time to unwind. So keep the lights dim. Think cave-like atmosphere. So dark with an orange glow. So I love to use like a salt lamp or candles, anything that gives off like a nice orange glow, like a cave. And that will help with your body clock. You want to avoid blue light in the evening. So blue light is, so you think about the sky is blue, right? So that tells our brain that it's daytime. So when we're getting blue light at night, that can also be disruptive to the body clock. So think about dimming the screen on the brightness on any screen that you're using. So if you're using an iPad, a phone, even if you're watching TV, you can dim the brightness on the screen. And lots of computers and phones and stuff now have like a night shift feature where it kind of turns orange after a certain time. So I'm using that feature. During your sleep zone, so during the time that you're actually sleeping, you want to keep your room nice and dark. And you could get blackout shades, or you could use an eye mask if you get a lot of ambient light in your room. I do recommend using a night light or something if you do need to get up and use the bathroom in the middle of the night. You don't want to trip and fall because it's so dark, so you can have a little night light or something like that. But try to avoid turning all the lights on if you're getting up in the middle of the night, because that can disrupt your body clock as well. Okay. And so then we'll just take a quick look at some supplements as well that can be helpful for sleep. So these are a couple of my go-tos, magnesium and L-theanine. So we'll take a look at magnesium. Next slide. Okay. So magnesium is an essential mineral. It's the fourth most abundant mineral in the body after calcium, sodium, potassium. Most of us don't get enough magnesium in the diet. So even if you're eating a really healthy diet, and even if you're sometimes taking supplements, mostly from diet, people aren't receiving enough. And there are many reasons for this. It could be the types of foods we're eating, but also we're learning that the soil is depleted of micronutrients, which include magnesium. And so you really want to be thinking about getting magnesium from food sources, but you can also think about getting it from supplements. So some food sources are spinach, legumes, nuts, seeds, whole grains are very rich in magnesium. In terms of supplements, you'll see that magnesium comes in lots of different forms. So magnesium citrate, glycinate, and threonate are typically the best absorbed. So those are the ones I usually recommend to my patients. And so what does magnesium do? How does it work for sleep? Well, one of the things that it does is it maintains levels of GABA. So GABA is a neurotransmitter that's involved in the relaxation response. So it helps to maintain levels of that neurotransmitter. It's also involved in the production of melatonin. And so studies have shown that magnesium actually improves sleep quality. It reduces the amount of time it takes to fall asleep, and it improves daytime functioning. So it has a lot of positive impact on sleep. Dosing. So I always recommend to be careful with dosing because some of the side effects are mostly GI side effects. So diarrhea, nausea, loose stools, abdominal cramping. So I have a pretty wide dose range listed here, 200 to 1,000 milligrams, magnesium citrate, threonate, or glycinate as well. But just be careful with that. And so I always recommend if you're thinking of adding in magnesium to talk about it with your doctor first and just make sure that it's safe for you to take. Next slide. So this is L-theanine. So L-theanine is a really great supplement that I use a lot in my clinical practice. So L-theanine is an amino acid. It's found in various kinds of tea, so green tea, black tea, and so forth. And so in nature, plants usually have compounds that balance each other out. So in the tea leaf, you've got caffeine, and then it's balanced up by L-theanine, which is calming. So it helps to balance out the stimulating effects of caffeine. So a cup of tea contains about 50 milligrams of L-theanine. Capsules are usually, they usually come in 100 or 200 milligrams. So you can see, so it's about, tea is just a fraction of that. I don't recommend drinking tea as your primary source of L-theanine if you're taking L-theanine for sleep, because the caffeine in the tea, of course, can be disruptive. So I recommend taking a L-theanine in a capsule form if you're using it for sleep, because then it's purified and it doesn't contain any caffeine. So what does L-theanine do? Some of the things that it does is that it enhances alpha brainwaves. So these are brainwaves that we see in meditation. So that's when you're in like an awakeful, relaxed state. So like you're calm, but you're alert, like when you're meditating. So L-theanine actually enhances those alpha brainwaves. So it promotes a feeling of being calm and being rested without causing sedation, and it actually improves cognition. So it's a really interesting supplement in that sense because it's one of the only things that we have that improves your focus and cognition without it being overstimulating, like a stimulant. So it's also being studied for ADHD, which is really interesting. So L-theanine increases GABA and it reduces glutamate, which is an excitatory neurotransmitter. So that is a neurotransmitter that can make us a little bit revved up. So it calms that down and increases GABA, which is involved in the relaxation response. And so L-theanine has been shown in studies to reduce sleep latency, which is the amount of time it takes to fall asleep. Dosing of L-theanine, so I usually recommend 200 to 400 milligrams of L-theanine capsules about 30 to 60 minutes before bedtime. It can be dosed multiple times a day. So I have patients who take it during the day to help them feel more calm and focused, and then they take it at night as well to help with sleep or relaxation at night. The maximum dose per day is 1,600 milligrams. So, quite a wide dose range, and it's generally well tolerated. So not a lot of side effects with that. And it actually works really well in combination with magnesium. So sometimes I'll recommend it in combination with magnesium and sometimes other supplements as well to promote relaxation in the evening, in addition to the behavioral therapies and techniques that we discussed. So again, I always recommend before starting any supplements to talk to your healthcare practitioner to see if it is safe for you. Next slide. Okay, so here we are just reviewing the benefits of using an integrative approach. So what it does is it helps to restore sleep, it helps with circadian regulation, it even helps with stress management, reducing depression and anxiety. Establishing a good routine is really good for not only for sleep, but also for your metabolic regulation, for your hormones. It reduces the risks of dependency on sleep aids like benzodiazepines and hypnotics, and it encourages the restoration of natural sleep patterns, and it helps to normalize sleep architecture, and then overall improves your sleep efficiency and improves sleep quality.
That's great. That's excellent. So I had a question. Well, people who are in Zoom, you're welcome to ask questions. You can type it in the chat window, and Dr. Nishi is here to answer the questions. But I wanted to bring up something in Ayurveda. They say that they actually don't recommend sleeping during the day. There's a big thing that they talk about that. So what are your thoughts about that?
Yes. Yeah. So in Ayurveda, like I mentioned, there's a focus on kind of really regulating your daily routines. And, it's thought that the different times of the day are associated with different doshas. And so you should be doing different activities during those times, right? And so one of the recommendations is not to sleep during the day. I have varying recommendations about this because it really depends on the person's needs. For most people, I recommend not sleeping during the day because it is going to disrupt the body clock and make it harder to sleep at night, especially if you're sleeping for prolonged periods of time. So if you're sleeping for more than an hour during the day, you can actually start to get into stages of deep sleep, which then takes away from your nighttime sleep quality. Mm-hmm. However, there are some conditions where very short kind of strategic naps can be helpful. So, if somebody has excessive daytime sleepiness like narcolepsy or some condition like that, it can be used prescriptively. Sleeping during the day can be used prescriptively. But the general recommendation I have for people is not to sleep during the day. Now, if you feel like you're sleeping enough at night, yet you're still tired during the day, that can be an indication that there's something else going on that needs to be evaluated.
Got it. So let's say your patient walks in, but then you'll analyze the patient with the composition in the sense like dosha from an Ayurvedic point of view, as well as then looking at the supplements and looking at, right? Is that how would you go about doing this integrative approach? That's what I'm assuming. I just wanted to understand a little bit for our viewers.
Yes, absolutely. Yeah. So my primary specialty is psychiatry. So I'm a psychiatrist and I'm a sleep specialist. So I'm a little bit biased because I always look for, first underlying medical issues. So I'm always looking to see, does the person have sleep apnea? Do they have restless leg syndrome? Do they have some thyroid condition? Is there something medical underpinning all of this? So that's always the first thing I assess for. The second thing then is looking at, is there depression, anxiety, is there some sort of stress or emotional issue going on that we need to look at that's exacerbating these issues? Then I also do the Ayurvedic part as well. That usually comes last for me after I do all the other pieces. But if we've kind of ruled out all the big things, then we'll start looking at, okay, is this a vata exacerbation or something? And are there some dietary interventions we can make? Can we tweak your daily schedule? So we kind of start from the gross and go into the subtle. So it's a very sort of like step-by-step personalized process.
And then you recommend yoga and breathing exercises as well, in addition to the supplements you talked about and other, right?
Yes. So I do recommend doing, various types of pranayama practices, especially if the person is in kind of like that hyper-aroused state where their nervous system is very active. So some of the things I might recommend are alternate nostril breathing, especially if they're feeling kind of imbalanced, that can be quite balancing. Sometimes I might have them do something like Simha Kriya, which is very energizing. So that can be useful in the morning if people are feeling very tired. So things like that. And then, sometimes doing sun salutation, something like that as well can be helpful. So again, it really depends on the person's needs and where they're willing to start. Because I have people who tell me, nah, I'm not going to do that. I'm not interested in yoga. Or I have people who have been practicing yoga for many, many years and are very, well versed in it. So it really varies.
Sure. But you recommend everyone to keep a regimented schedule, as you said earlier in your slides as well, right?
Yeah. So, that's one of the things my patients are probably sick of hearing about is the circadian rhythm and the importance of regulating their daily schedule and really waking up at the same time every day. Having, getting bright light exposure at the same time every day, having your meals every day around the same time is really important. So the two things that really affect our body clock very profoundly are light exposure and the timing of meals. So if you can regulate those two things, like in a very regimented way, it can have a profound impact on sleep quality.
Okay. We have a question coming up All right, let me just stop the share. I'm going to stop sharing so people can ask any questions if they want with confidential. All right, so they say, do you recommend using magnesium in children? So if the kids have a problem in sleeping, which I don't know, my kids have always slept like babies, but but maybe the kids have problems in sleep nowadays. So what would you recommend, using magnesium in them as well?
In kids, so I'm not a pediatrician, so I always recommend working with one's pediatrician about adding in supplements and things like that. But with kids, some of the things I like to look for are sleep apnea, actually. So sleep apnea is actually very, very common in children and is frequently missed. So if kids, and it presents differently than it does in adults. So adults with sleep apnea usually have trouble sleeping, and then they're sleepy and tired during the day and have trouble concentrating. With kids, it presents very differently. So with kids, they usually are like pretty hyperactive during the day. It can almost look like they have ADD or ADHD. So they're hyperactive, they're irritable, they're like energized, bouncing off the walls. That's how it can present in children. And then it causes difficulty with sleep. So I always recommend evaluating for that. And that can be done by their pediatrician or a pediatric sleep specialist. So sometimes in kids, sleep apnea can be caused by large tonsils. So simply looking in the back of the airway can help, or it can be caused by like nasal polyps or other obstructions in the airway. The second thing I always think about with kids is restless leg syndrome. So I had mentioned that earlier as well. Sometimes that can be indicative of a deficiency, sometimes in magnesium, but also iron deficiency is a common reason for that. So, so once you've assessed the root cause, then you can think about layering and other supplements or other techniques.
Hope that answered the question. There's a follow-up question on that. Okay, so well, someone seems like the issue. The question is, how about kids with ADHD who have sleep issues? That's question. Can you use magnesium for the kids who have ADHD?
Yes, magnesium can be used. And again, I always recommend talking to the pediatrician about dosing and all of that stuff.
But the magnesium can be safely. So there's a milk also, in Ayurveda, they talk about having warm milk with the turmeric, at night, and that helps with the sleep processes as well.
Yes. So warm milk is, it's really interesting, actually. There was a study that came out in January of this year, looking at foods that help to promote sleep and foods that promote melatonin, and milk is one of them. So Ayurveda knew this, 5,000 years ago. Modern science is showing us now. So milk and even oat milk. So if you can't take dairy, for whatever reason, maybe you're vegan or you have lactose intolerance, you can do oat milk. Both milk and oat milk are very high in tryptophan and high in melatonin. So warm milk in the evening with some turmeric, you could add some like cardamom, you could add nutmeg, cinnamon, whatever you want, it's like a little latte with no caffeine. It's very good for promoting sleep. It's also very good at quelling hunger. So we talked about hunger being a cause of sleep issues. So having that, like an hour or so before bed can prevent you from waking up from hunger as well.
And a lot of, so the question is, what are your thoughts about using melatonin dosage?
Yes. So melatonin I think of more as a sleep-wake regulator than a sleep aid. So it's more of a body clock regulator. Yeah. So melatonin, like I said, is produced by our brain at night to, kind of tell us that it's time to go to bed. So it doesn't make us sleep per se, but it's more of a body, it's a body clock signaler. So I use melatonin for people who have body clock issues more than insomnia issues. So if somebody has, delayed sleep phase syndrome, for example, where they have trouble falling asleep until, the late hours of the night, midnight, 2 a.m., and they can't wake up for work on time, we'll use melatonin to hold their sleep earlier. I use it in very small doses, like 0.5 milligrams, rather than 3, 5, or 10 milligrams, which you find in stores. Those are usually just way too high. So very tiny doses can sometimes be enough, used in a strategic way to regulate the body clock. I usually recommend not using it for more than about 8 to 10 weeks at a time, because sometimes it can cause long-term issues with depression, vivid dreams, nightmares, even long-term issues with fatigue. And I see that a lot in my practice. So for short periods of time, short doses, melatonin can be useful.
Just to push the body clock a little bit. And a lot of teenagers, have this issue right?
Yeah.
They won't sleep until 2 o'clock and then they wake up at midnight, or I'm sorry, noon the next day.
Yes, exactly. Very common. About 16% of teenagers have that issue. So using melatonin and light can be really helpful to shift the clock earlier.
Okay. Okay. Any more comments or feedback or questions before we wrap up this session? Okay. I think, yeah, well, any last comments from you, Dr. Nishi, before we wrap up this afternoon?
Yeah, well, thank you for having me. This was a pleasure. And I have a free sleep guide that's available. I think Amita can share the link. Yeah. And so I have information about melatonin, L-theanine, magnesium, ashwagandha, various supplements where information's in there. Some Ayurvedic tips are in there as well. And just some general, sleep hygiene tips are in there too. So I think Amita will make that available.
Yeah, and then we'll be offering your sort of like a wellness program soon, or some kind of a workshop. We'll talk with Dr. Nishi and come back to our viewers what we will be offering, hopefully, by the end of this year, if not at the beginning of the new year. All right, thank you so much. With that, I'd like to thank you so much for joining us. And yeah, have a great weekend. It's a beautiful, well, it's a very hot here where I am. I don't know how the weather is there in Sausalito.
It's the same.
Okay, well, enjoy your weekend. Thank you so much, Dr. Nishi, for being with us. Thank you, everyone, for watching. Bye-bye.